raise your hand, okay? And we're going to be talking a little bit about COVID and depression. Oh. Can we hear you?
Can you hear me? Testing 1, 2, 3.
Everybody? Okay, good. Okay. Go ahead, Dr. Regina. You can walk around with that as long as you take this with you.
That's good. Thank you. Good afternoon or good morning, everyone. I'm Dr. Regina Esihene. Can you hear me okay? Yeah. For some reason, I feel better if I do it this way. I am from Ghana, and I've been in the United States since I was 6 years old. I've been a doctor since 1992. I graduated from Morehouse School of Medicine, and I did my clinical training at Cambridge Hospital of Harvard Medical School. After finishing at Harvard for 6 years, I moved to Florida in 1998, and I worked for Florida Healthcare Plans. I've been with them for 22 years. I also worked for Vitas Hospice, and I just opened up my new business, which I've given you the brochure. I'm the owner of a new assisted living facility. The new facility is called Majestic Gardens Living, and it's different from all the previous places because we can keep a doctor, a nurse, and a nurse assistant at all times in the building. So anyone who needs additional help would probably benefit from it. We only have 16 beds, so it's a very specialized type of health care. And it might be something that would help Buzzy, as I was listening to the prayer request.
Thank you.
Yeah.
Yes. Today we're going to talk about COVID-19 and the effects on people's mental health. Now, coronaviruses are not new. We've had viruses in the past, but in 2019, a new strand of coronaviruses came on the scene. It's called SARS-CoV-2 or COVID-19. The 19 refers to the year that it started. This coronavirus has given the entire world a scare. We were all advised to take shelter, limit our exposure to public areas, to remain under quarantine in an effort to stay healthy and safe and to stop the spread of COVID-19. The Centers for Disease Control, CDC, and the World Health Organization set the guidelines to slowing down the spread of the coronavirus. They recommended that we maintain social distancing at a minimum of 6 feet. As a result of global and social distancing measures, some countries, cities, and states even closed all non-essential businesses, and they limited the number of people that can gather in groups. Examples of some of the essential services that remained open during COVID were the banking services, the grocery stores, food service delivery, medical facilities, and private workplaces. Outside of these limited activities, public officials worldwide recommended that we stay home in a global attempt to slow down the spread of COVID-19. Many of us are not used to this social distancing and quarantine. In fact, spending so much time indoors had a profound effect on mental health. People were in very close proximity with their loved ones, their spouses, their children, or some people were alone for very extended periods of time. A report from the World Health Organization found big increases in certain mental illnesses due to the pandemic. After a year and a half of loss, stress, isolation, trauma, the U.S. is beginning to see a major increase in anxiety and depression. There are a lot of people struggling with their mental health at this time. In fact, the pandemic has had a major impact. The prevalence of anxiety and depression have more than doubled to the pre-crisis area in most countries. And this is documented by data most notably in Mexico, the United Kingdom, and the United States. A recent study in the Journal of Pediatrics showed that 140,000 children have lost a parent or a grandparent caregiver to COVID-19. So a majority of those children are also under stress. And most of those children were children of kids of color. Pediatricians say that the mental health crisis on kids has been the biggest national emergency. The grief, anxiety, and depression that children have experienced during the pandemic is overwhelming, and it's beginning to spill over into the classrooms and the hallways. It results in crying, disruptive behavior in many of the younger kids, and there's been increased violence in adolescent kids. For many of the other children, their sadness, some children just keep their sadness and fear inside, and the pressures of school have become too much. The mental health impact of the pandemic has been particularly hard. Thank you. You couldn't go around my ear. It's been particularly hard for doctors, nurses, long-term caregivers, and other healthcare workers working in close proximity to patients. Younger adults, racial ethnic minorities, essential workers, and unpaid adult caregivers have experienced disproportionately worse mental health outcomes, and increased substance abuse has been one of the results, as well as elevated suicidal attempts. According to a CDC report which surveyed adults across the United States in late June 2020, 31% of responders reported anxiety or depression. 13% started using substances or increased the amount of substances they were using. 26% reported stress-related symptoms. 11% reported thoughts of suicide in the past 30 days. These numbers are nearly double the rates before the pandemic. The survey shows that the risk factors for reporting anxiety symptoms included food insufficiency, financial concerns, and loneliness. Deaths due to opioid overdose rose substantially in the context of the pandemic. Patients who required hospitalization due to COVID-19 also had effects. After COVID, people developed what we call COVID fog. This neurocognitive impairment caused impaired attention, concentration, some memory loss, and slow mental processing. And the effects of the cognitive effects of COVID can last up to 1 year in a majority of patients, especially those who had severe respiratory symptoms and those who were hospitalized and put in the intensive care unit. Substantial fluctuations in the quality of life were found in those who had very severe COVID and those who were put on ventilators after discharge from the hospital. Now, in a different way, the economic recession has been associated with increases in the prevalence of psychological distress. Unemployment, insecure job situations, lower socioeconomic status, and pre-existing psychiatric problems are determinants of mental health issues. There's even a stigma against the survivors of COVID-19 infection. And there's a stigma against healthcare providers. People are afraid of them. They don't want to be around them because they think they're still spreading COVID. And this has resulted in harassment, stereotyping, discrimination, social isolation, and in some cases, even physical violence. The stigmatized individuals then experience more emotional disturbance, anxiety, or depression. The mental health impacts of COVID-19 are still continuing. We don't even know the full impact of everything. But it's crucial that as healthcare providers and as the community, we build together and work towards strategies that help to support the mental health needs of all the Americans. These strategies have to be done broadly, especially in the vulnerable communities. And we want to enhance mental health services to everybody in society. We're now doing what they call telepsychiatry. If you need help, you can contact the doctor without even physically going in, just by phone, by video, chatting. We also want to do more early assessment of those who are at high risk, start early treatment, and do more psychosocial support and screening. We must implement long-term measures to mitigate the impact of economic recession on mental health, and we want to address the stigma during the pandemic. How many of you know someone or have experienced some kind of anxiety or depression due to COVID? It's a lot of people. And healthcare providers are taking a big hit as well. Are there any questions or concerns about this topic?
I was just reading, they've discovered a nasal spray that will stop depression in 30 minutes or something like that. What do you know about that?
It's still under research, so we don't know that much yet. And they have to do more clinical studies before it's available to the public. Yeah, but there are a lot of antidepressants that are available now that are very helpful. And there are other non-pharmaceutical ways to deal with depression. For example, the number one thing that helps mental health is actually exercise. Research has shown that if you do 30 minutes of exercise 4 days a week, it changes the endorphins in your body and changes the chemical balance in your brain, and it helps to keep depression down. In fact, exercise also keeps not just depression, but dementia. It's one of the major things that prevents dementia, is exercising. So it just keeps all the chemicals in your body in the right proportion as they're supposed to be.
I found that guided meditation has been very helpful.
Yes, meditation is also helpful. And of course, there are all counselors, mental health counselors. There's so many ways to deal with the depression, anxiety. Some are having post-traumatic stress. There are many, many ways that things can help. Other questions? Yes.
So what is your take on this vaccine? If this vaccine, once taken, doesn't keep you from getting this COVID-19, doesn't keep you from spreading this disease, why are they so adamant about us taking this vaccine?
Right. I don't want to get too political, but just to answer the question very briefly, the vaccine reduces the risk of everything. It reduces your chance of getting COVID. It reduces your chance of spreading COVID. Nothing we have is 100% perfect. No vaccine, nothing, no medicine, anything is 100% perfect. But what it does is reduce the risk. And so the chance of spreading it, getting it, is reduced. And when you get it, the symptoms are much less. It's much like the flu shot. You take it to prevent the flu. You can still get the flu, but the level of your symptoms will be reduced. Not as bad as it would have otherwise been.
So from past experiences, that flu shot, I took one flu shot many years ago. I ended up with scarlet fever.
Some people are
So
sensitive and allergic to
I'm
different
not-
shots.
I have no intentions whatsoever ever taking this vaccine ever.
Yes, everybody can make their choice. I don't want to get too political on that. Yes, and you have to look at each case by case. Everybody's system is a little bit different, and everybody has other comorbid conditions that have to be considered. Yes. All right. Yes.
Is there any data about the people who get what you call the long COVID that continue to have this, I think you called it something different, that continue to have the symptoms after they've had the
there's not a lot of
Can you say
data.
the question again, 'cause
Oh,
some-
yeah, okay, so the question is there data that, describes long-term effects of having COVID disease itself? Is that correct?
And who, it seems that some people rebound and as if they never had it. And then some people continue to have the respiratory problems, the fatigue.
Yes,
And I was wondering, yeah.
yes. Yeah, she's saying that some people rebound very well after having COVID, and other people have lingering symptoms that continue. There's not a lot of data on this. This is happening as we go along. And unfortunately, there's not a follow-up system. So when you're discharged from the hospital, you follow up with your primary care doctor, and there's no one documenting what your lingering symptoms might be. But each person is different, and you can't even explain why some people get symptoms for so long. There are young people who have lingering symptoms, and then there are older people, 100-year-olds, who bounce right back and just get back to life. So it's not clear. There's so many things about COVID that we just don't know quite yet. That's a good question.
I had a close personal friend, a very close personal friend, who matter of fact, he asked me, because I'm a numismatist, he asked me for some silver dollars, and he put them in a pan and he boiled them and he drank the liquid, because he said if you drink silver liquid, you won't get sick. And he said, for whatever reason, I don't want to take the vaccine. I will not take any vaccines or whatever.
There's no research about the liquid.
A week past Thursday, he was coughing so badly, he went into the emergency room, went into Halifax Hospital. On Tuesday, he died.
Oh my gosh, I'm very sorry to hear it.
I'm very sad too, because I've had all of the shots and everything, and have I had discomfort? Yes. Have I had sweating at night? Yes. As a matter of fact, right with you, Pastor, she had it, the same thing. I woke up in the middle of the night, I got hallucinations and sweating and everything, but I think that COVID is worse, and I know it. The symptoms that I had only lasted for 24 hours, and then they were gone and everything, and now I feel, mentally I feel better.
Yes, although COVID is our biggest concern, there's still other viruses that exist.
Oh, yeah.
And if you get a viral infection and it's gone between 24 and 48 hours, that's a different type of virus. We almost forget that the common cold is still the most common thing. This is still flu season, so people still get the flu. In fact, I had a patient who came to me, and he was very sick. He had been tested 3 times for COVID, and I did an x-ray thinking maybe this is pneumonia. But you know what it turned out to be? Just the common flu. The common flu is still there, and we forget that other viruses are still there. We're so concerned and always consumed by COVID that we forget that there are other things that are still going on. Those things never went away. They're still there. Old diseases are still there as well. So yours sounds like it was a viral infection, but not COVID.
Yeah.
Yeah. Any other questions? Yes.
Yeah, I work for Florida Healthcare, and we were given the Johnson & Johnson
Yes.
shot. Okay, I'm just wondering about the booster, because they're not offering a booster with the Johnson & Johnson. I was wondering, can you cross over and get a booster?
Yeah, this is a very good question. She had the Johnson & Johnson vaccine, and now the question is, they're not giving the booster for Johnson & Johnson, and can you mix and match the vaccines? The answer is yes, you can mix and match it. According to the CDC, it doesn't matter which vaccine. If you want the booster, it's recommended 6 months after your other shot, your last shot, the second shot, and you can mix and match Moderna, Johnson & Johnson, or Pfizer. You can mix and match.
I've done it.
Oh, okay, one person's had a booster here.
I had the J&J, 6 months later, I got the mRNA booster, and the research has shown, I'm a therapist, and the research has shown that you're actually better protected if you cross-pollinate
I was gonna
the
say.
J&J with the mRNA.
Yes.
So you actually have a better level of protection if you cross-pollinate the two.
Yes. Okay, what she said was that it's better to cross-pollinate the different vaccines.
Yeah.
Yeah. I had the Pfizer vaccine. I actually got it the first week that it was available to the public. Being a healthcare provider, I knew that the risk was gonna be high. I visit patients in their homes, I visit patients in hospitals and nursing homes, and I didn't wanna be an asymptomatic carrier to somebody else. So as soon as it was available to the public, well, to healthcare providers, I got it done that first week. At that time, only Pfizer was available. Then I went for my follow-up and had my booster as well. We have to do what we can to protect each other. Any other questions, comments?
Just a comment about what was said earlier. I'm sure no one here plans to go home and boil silver dollars. But,
Okay, a comment that I wanted to make was that silver dollars are not total silver, and they're lead in silver dollars. Lead can kill you. And I'm sure nobody wants to go home and boil it. However, I grew up in Mississippi, and there was something in Mississippi that was spread around that on New Year's, you're supposed to eat black-eyed peas cooked with a silver dollar in it. That's all I have to say.
We don't want lead poisoning,
No.
so I don't recommend any metals to be consumed.
No, but silver, not to prolong this or anything, but silver is a type of an antibiotic type of thing, if you get it right, if you do it right. Is that not correct? But I'm not talking about
I
silver
think
dollars.
we
or
should let
anything.
the scientists do it.
Okay.
Instead of trying to make your own concoction of how
Of
much is
course.
right. Yeah,
Of course.
it possibly has them, but I think it should come from a pharmacy or
Of course.
scientist or a chemist or
course.
something of that nature. Yeah, and it's not safe to try to make your own.
No, absolutely not.
All right, any other questions or comments?
Thank you
All right.
very much.
Thank you, Dr.